In today's video, I am going to explain three structures that can be cause for anterior hip pain. Hip is very wide range and three-dimensional structure. People might have anterior hip pain, lateral hip pain, medial hip pain, or posterior hip pain. Today's topic is about anterior hip pain. Let's get started from these two muscles. These two muscles are kind of an individual muscle. They are separated. However, I want to treat these muscles as one muscle in this video. This right side one is psoas. And this left side one is iliacus. Then sometimes these muscles together, it is called iliopsoas. If you want to talk about lumbar movement and pelvic movement, you should separate psoas and iliacus. But I am talking about anterior hip pain, anterior hip anatomy. Thus, you can combine iliopsoas as one muscle. Why is this muscle so important? Look at its location. Look at its anatomy around hip joint and inguinal area. They are very close to hip joint. It's right here. Oh, by the way, if you don't know where hip joint exactly is, criteria is this part, this connective tissue. This is inguinal ligament. Inguinal ligament is connective tissue that is around inguinal area. Hip joint is just below inguinal area. Imagine there is head of femur like this, and this head of femur fits to acetabulum. This concave surface of pelvis is called acetabulum. It's like ball and socket joint. Ball is head of femur right here, and socket is acetabulum like this. And imagine there's neck of femur like this and shaft of femur like this. Head of femur, hip joint is literally very close from inguinal ligament. This is very good criteria, very good anatomical tip to palpate around hip joint. Anyhow, iliopsoas is very close to hip joint. If these two muscles get tight, you cannot stretch out hip joint. You cannot extend your hip joint. Or when you do hip flexion is like knee up movement. You feel some kind of stuck around here. Most likely, your iliopsoas is tight. And then you cannot stretch out. Plus, you cannot use iliopsoas very well. And you feel stuck right here. They are literally close to hip joint. Then if these two muscles get tight, of course, that can be cause for anterior hip pain. Very important hip muscles. Number one, psoas and iliacus. Let's go to next one. Next one is this one. This is rectus femoris. Rectus femoris, this is part of quadriceps. There are 4 muscles in quadriceps, right? However, rectus femoris is only quadriceps muscles that attaches to pelvis. Yep, this guy attaches to pelvis. Thus, this can move hip joint. Other 3 muscles attach to femur. Only rectus femoris attaches to pelvis. Then let's go to a little bit a different angle. Again, this is rectus femoris. This guy attaches to pelvis. Plus, there is kind of another fiber from rectus femoris. And this is still rectus femoris, but different fiber. This yellow one, the other fiber attaches to very close to hip joint. Imagine this is edge of hip joint, like this. This fiber attaches to really close to hip joint. That means this fiber is close to hip ligament, hip joint, right? If this guy gets tight, it directly affects for mobility of hip. Of course, that can be cause for hip pain. Rectus femoris is considered as knee muscle. However, this is equally important for pelvic movement and of course for hip movement and hip mechanics. Very, very important. Number 2 is rectus femoris. Actually, next one is not muscle. Next one is nervous tissue. Alright, you see many nervous tissues. I want to talk about this guy. This is femoral nerve. Femoral nerve, that is from lumbar spines, emerges here, then it passes on anterior part of hip, right here. So no doubt, if femoral nerve gets tight, that affects for hip pain. Plus, femoral nerve sends a sensory branch for anterior part of hip joint. So if femoral nerve is somehow aggravated, that creates pain around here. Then how come femoral nerve is aggravated? There can be numerous reasons. Look at here, this part. This part of femoral nerve is kind of a sandwich between iliacus and psoas. I erase the drawing so you will see the clear relationship again. Alright, again, this is femoral nerve. You see, there is psoas and iliacus. They are kind of sandwiching femoral nerve. If psoas and iliacus gets tight, there is impingement around here. And from here, maybe hip joint can be aggravated and can trigger hip pain. This is very important thing. Then one another reason can be the physical trauma around hip joint. Maybe you got a broken hip, maybe you got a broken pelvis, or maybe you have a physical trauma around lumbar spines. Why lumbar spines? Because femoral nerve is from lumbar spines. Physical trauma can tighten up, can damage nervous tissues. Then associated structure can get numbness and pain. Femoral nerve is important for anterior hip dysfunction. Very important. Now, I talked about 3 structures. Iliopsoas, rectus femoris, and femoral nerve. Then, how can you do kind of self-treatment for anterior part? There's a way. This is very famous yoga pose, right? Then I want you to focus on this part. In this leg, this is extension position. Extension position. In this position, iliopsoas and rectus femoris and femoral nerve are stretched out. Yep, they are stretched out. So if you do yoga, stretching, Pilates, self-treatment, you focus on iliopsoas, rectus femoris, and femoral nerve. You can focus that because now you know the anterior hip anatomy. So you can focus on each structure and feel there is stretching around this area. Knowing anatomy and having visualization of anatomy increases self-care treatment. Of course, that increases for athletic performance. That is why knowing anatomy is very, very important. And if this inguinal area is tight, when you bring hip joint up, this is hip flexion, you somehow feel stuck on anterior hip. That's maybe anterior part is tight. Maybe your iliopsoas is tight. Maybe your rectus femoris is tight. Maybe your femoral nerve got physical trauma. Then you feel somehow stuck around anterior hip. Then you do the same thing. You focus on inguinal area and you try to bring awareness here and you try to stretch out this area. Anterior hip, inguinal area are so important for hip dysfunction and hip pain. If you liked today's video, please hit the like button, comment and subscribe. See you next video.